So good afternoon, everyone. I gather folks can hear me. It's 2 o'clock. We'll go ahead and get started. Those of you who don't know me, I haven't had a chance to meet everyone just yet, but I'm Monique Guillory. I'm the new Chief of Staff and Senior Vice President in the Office of the President. And this is the first of what is going to be a bi-weekly town hall to provide COVID updates. We want to thank Deb Sullivan for getting us started and helping to ramp us up as we were preparing to return to campus. We now have a new Vice President for Communications on board, Ms. Leanne Hall. So we are now going to be coordinating bi-weekly town halls to provide the campus community updates about the kind of moving target of COVID-19 mitigation and management. We will be doing these every Thursday at 2 o'clock, so help spread the word. And we're putting in several other resources to support the management of COVID on our campus to protect our bubble, as President Mason likes to say. In addition to these biweekly town halls, you will see from UDC Communication what we're calling a weekly COVID newsletter with COVID updates. So you saw that, I think that came out yesterday with some information, some critical information about the reporting a positive case process. So we have that. And we also will be promoting our COVID confidential at udc.edu email address. Mr. Baker is going to talk a little bit more about that, but that is a special email address that we've set up to handle all things COVID, all matters pertaining to COVID, whether you are an employee or a student. We want to encourage people to direct all questions, all communication about anything related to COVID to COVID confidential at udc.edu. Mr. Baker is going to talk about that. We have had our first employee positive since returning to campus. And so this has been an important opportunity for us to test our processes. And so with that, I'm going to invite Mr. Baker to bring us an update. Thank you.
Thanks, Monique. And I want to welcome everybody back to campus and thank you for attending this meeting. I'm glad that we're going to be doing this on a regular basis, and so be able to address any challenges that we might be having or any difficulties that individuals might be facing related to this. As was already said, I do need to report that we had one positive case of COVID-19 among our employees since returning to campus. And we anticipated that there would be some cases on campus. And so that's not surprising. That individual is in isolation and is recovering well. The individual reported the case through COVID Confidential at udc.edu. It was subsequently reported to DC Health, the Department of Health, who performed contact tracing very quickly. And there were no actual close contacts deemed by the Department of Health, but as a precautionary measure, we did notify some people in the general area of the employee to go ahead and get themselves tested if necessary. And so I do want to reiterate the policies and procedures that we put into place for notifying the university if you found out that you're COVID positive, okay? And so while we hope everyone is safe and that it doesn't happen, we do anticipate that there will be some positive cases, right? So please, it's not required that you notify your supervisor nor your professors or advisors that you're COVID positive or anything about your health or medical status. Please report directly to, as Ms. Guillory said, COVID Confidential, all one word, at udc.edu. That information will come directly through to myself and to health services and a select number of other people who will be part of the core team that is responding to individuals to make sure they have the services that they may require and to make sure that we follow through with the reporting that the university is required to do. Okay. Um, if you do test positive for COVID and you do notify the university through that web address, through that email address, please be sure to include, of course, your name, which we'll have, and your email address, but include your personal telephone number, a number where somebody from the university can reach you, or where somebody from the DC Department of Health can reach you, because the first couple of steps after we've been notified are to reach out and try to make arrangements, whatever is necessary that needs to be done to make sure that you have everything that you need. That may include telework, that may include working on assignments, academic assignments from home while you're in isolation and recovering. I do want to say also that the reporting to COVID Confidential of a positive case, that's when the university initiates our protocols. And I say that because there have been some instances in which a student, for example, may notify their professor that they believe that they've been in contact with someone who may have tested positive. Right? These are secondary contacts or contacts of a close contact. And in those instances, we are not requiring anybody to stay off campus or to really initiate any sort of activities. The initial action is initiated when we receive the notification that there has been a positive COVID test result, right? So that comes directly through to us, and it does not have to go through faculty members or supervisors. And of course, when you do receive a notification that you've tested positive, please try to include the copies of your test results in with that notification. Or if you've been deemed a close contact by the Department of Health, please include that information, those details in your initial communication through COVID Confidential. That helps us to sort of verify and move things as quickly as we can. Throughout the course of your isolation and treatment and recovery, at some point you're going to need to get tested in order to return back to campus, to be cleared to return to campus. You'll need to get a negative COVID test, a PCR based test, not an antigen based test, but a PCR based test, which is what I think most of the clinics and other free services that are being offered, free clinics that are being offered by the district are using as testing. We need to receive a copy of your negative test results in order to issue you a clearance so that you may be authorized to return back to campus. And I think the last thing I want to say is that if you're sick, if you feel symptoms and you're at home, please stay at home. Please stay at home and make arrangements with your professors, with your supervisors to take sick leave or whatever you need to do to stay home and take care of yourself. If you're on campus and you begin to feel symptoms, you can call University Health Services at 274-5030, and you can schedule a same-day COVID test, right? So if you're begin to feel symptoms, you're just not feeling well, or if you think that you need a COVID test, please understand that the university has the resources available to assist you on a same-day basis. And I think the last thing I want to just mention, and we all know this by now, is that we have a mandatory mask requirement on campus. That includes in all classrooms, in the bookstore, in the student center. Masks need to be worn 100% of the time, unless you're in an individual office or in your designated eating area. It is not a decision that employees or students can make amongst themselves to get together in groups and pull down their masks or remove their masks if they're on campus. That's a violation of our current policy. And so please understand that masks are required at all times. And if you don't have your mask on, there will be people around that will remind you to please put your mask on and to wear it correctly. I think that's all I wanted to cover this afternoon. I know that there are many other people that want to share, so I'll leave it at that and answer any questions that might come up. Thank you.
Thanks, Alex. Just to clarify our format today, we are asking people to post their questions or comments in the chat or in the question section, and we will go through those before the end of the meeting. We are trying to open up myriad venues and channels of communication for employees and students to voice their concerns, to ask questions. Certainly, we will address them in today's proceedings. This is being recorded, and we will find a way to post this at the RISE website. These will be recorded from here on out. Also, again, if you have a question or a concern after this town hall regarding COVID, again, you can email it to covidconfidential@udc.edu. We have ensured that you will receive a response within 24 hours. Anything that is received through that email address will receive a response within 24 hours. So I'm going to now ask Ms. Sullivan to bring some updates about employee vaccination rates and just some clarifications about employees and COVID. Thanks so much.
Dr. Guillory, before VP Sullivan speaks, I just want to clarify something. Mr. Baco, in his statements around the students and or employees are not required if they should not report to a teacher. They should not report. It is not required. You should only report based on what the guidelines say. So if you are a student, you should not be reporting your COVID status to an instructor. And if you are an employee, you should not be reporting your COVID status to your supervisor.
Thank you, Dr. Potter. That's an excellent segue into the data that I'd like to share with the group. So first and foremost, I just want to thank everyone for participating today, and we'd love to have these sessions so that we can really share information so that people really have their finger on the pulse of what's happening at UDC. And so first and foremost, we are now from an employee side of the house at 82.7% fully vaccinated. That includes 1,197 of our employees full-time and part-time. That leaves about 207 people in an other category. So just to be clear, you'll understand the data as I walk through it next. So that leaves us with about 207 employees who are in some kind of status. We've received about 25 requests for medical or religious exemptions, and to date, only 9 have been approved. So you'll see that that number is extremely small. In those exemptions, that's about 4.3% of the total 207 that are not fully compliant. We have about 73 employees that are in a full remote status. That's about 35% of that 207. And that means they either received a waiver to work outside of the DMV, they are not reporting to campus, or they have a fully remote or total online course schedule that they're teaching. But that number is about 73. And then we have a total of 125 employees who are in some status of being non-compliant. Those are the employees who received letters indicating that they were not allowed to report to work. Any employee in the non-compliant status is required to use leave if they have it, should they not want to be on leave without pay. Employees who are non-compliant have about 30 days to meet the mandatory vaccination requirement. And we work directly with those employees through human resources and their managers. Are only notified when needed. As such, I wanted to just clarify. So you'll notice that the number of people requesting exemptions is really small. And we know that employees wanted to know, if I'm coming to campus, what is the risk of me encountering someone who is unvaccinated? I want to share that the university is doing everything in our power to ensure that our employees are meeting the vaccination requirement or they have received an exemption. So, as Mr. Bako reviewed that process, so once someone submits their status to COVID Confidential, Mr. Bako then and HR, we work very collaboratively together. We, HR for employees, we are the ones that will communicate with the managers when someone is out. And then we also work with the employee on the type of leave or if they need additional support while they are recuperating from their diagnosis, or if they're just quarantining. But HR will help determine your work status during that, or leave status during that period. Again, we encourage everyone to go to COVID Confidential. That allows the university to truly manage this and really communicate with the employees and managers that need to know. We do protect people's information, so it's not just broadcast, as you will notice in our conversations today. Managers should not be communicating with any employee who is out on sick leave. We do give those instructions, but as always, the Office of Human Resources is available to support employees and managers as we work through a positive diagnosis, or if there's a close contact. Those instructions will come from our office. I just want to really celebrate our university community. Since this pandemic started, we have had a very low incidence of positive cases. And as Mr. Bako said, yes, when we're reopening, we do anticipate some increase in positive cases, but I just celebrate everyone for all you have done to, one, protect yourselves by wearing masks and practicing social distancing, and all that you're going to do, and being careful with your actions as you are on campus. The RISE website is there to provide everyone with information. And so I just want to thank you for all your efforts and what you're doing to help keep our community safe and minimize the spread of COVID-19. Thanks.
Thank you, Deb. Next, we are going to hear from VP David Franklin to give us some updates about our facilities and our space. Thank you.
Dr. Gary, can I just answer one quick question that was in the chat? It's about an exemption. Yes, if someone is granted an exemption, they are required, one, to wear a mask at all times, and two, to be tested weekly. And we do monitor the testing. Thank you.
Thanks, Deb. And we will address all of the questions and comments that were posted in the chat before the end of this meeting, regardless of if it goes over 3 o'clock. We will address all the questions and concerns raised in the chat. Thank you. Mr. Franklin.
Good afternoon, Firebird family. I'll give an update at this point in time as it pertains to our facilities and real estate management. The Office of Facilities and Real Estate Management has continued to maintain and upgrade the various campuses and provide services needed for safe operations throughout COVID-19 pandemic. The fall reopening was brought an increase in students, faculty, and staff on campus, and we will continue again to provide the environment, a safe environment as possible. With respects to signage has been changed to emphasize that vaccines and mask mandates are required unless there are exceptions to that of the vaccine. Classrooms and labs have been restored to the pre-COVID configurations, and barriers have been removed from desks, unless we're talking about spaces where there are a significant amount of frequent traffic or interaction with individuals. With regards to our cleaning, we continue to use the COVID-19 recommended cleaning disinfectants, and that is being used by the contractor, or janitorial contractor, Fifth Element. We continue to increase cleaning frequently of high nuisance spaces, such as the classrooms, labs, restrooms, elevators, doors, handles, elevator buttons, and even some computer keyboards when asked upon. The cleaning schedules are based on scheduled daily updates that are provided by our facilities and real estate management team. The building systems, we have changed all our air filters, and we continue to use high efficiency filters throughout the campus. We plan on changing the filters now at least once a month. We continue to maximize and improve the air quality of the university and all of our spaces. One of the things that we're currently doing, we have received a significant amount of funding, capital dollars, and we're going to start to really and truly improve some of these spaces, starting with building 39, improving the HVAC, the mechanical engineering and plumbing systems across the university as a whole. We have relocated several units over the last couple of months. The Office of Information Technology has relocated to the 3rd floor of building 4250. The IT hub is located on the 2nd floor of building 4250. Record management has been relocated to building 44, the 1st floor, and past relocation has been completed and now in building 42 to building 39, the 2nd floor. We have numerous capital projects that have been recently completed. I just mentioned a few. We have completed the replacement of the elevators in building 38. We've done the roof replacements on building 32 and building 42. We've completed the warehouse renovations in building 38, and we've just done the ribbon cutting for our tennis courts renovations. There are several other construction projects in place. We're looking to complete the project as it pertains to that of the Causes Kitchen that is at Bacchus, the replacement of elevators in building 32 and 42. We're doing the new turf on our athletic fields and the gymnasium. We're replacing again the HVAC systems and ductwork in the gymnasium, and we're building out the cafeteria inside the student center. With respects to FY22, I'll just mention a few projects that is on the horizon. Again, more HVAC upgrades to building 38, 39, the installation of solar panels on the roofs of building 38, 32, 42, and the replacement of the roof at the auditorium and building 39. We have, again, as it pertains to that of our lease space, we have several capital lease projects in place in commercial lease. In FY21, we have brokered two deals, one with All Cares, Urgent Care at Building 52, and we recently brokered a deal to partner with that of Mom's grocery store at Building 4250. And that concludes the update from a facility standpoint.
COO Franklin, will you provide information and update on the shuttle schedule? I know a lot of people are interested in the shuttle schedule.
Yes, so we just recently brought back the shuttle. The shuttle will be running as it was pre-COVID. We will be providing shuttle services from that of the Van Ness campus to 801 and from 801 to Bacchus. We also will be running the shuttle from that of our Old Congress Heights location directly back and forth to the metro station. I'll go ahead and put in the chat the actual schedule of our shuttle bus services where that can be found as well.
Thanks so much, Mr. Franklin. And we are aware that there are some questions in the Q&A, so we will make sure we cover all of those, both in the chat and the Q&A. We will hear now from Dr. Latham about updates that are pertaining to students and student development.
Good afternoon, and again, hello and welcome back to all on the call today. Thank you, Dr. Gilby, for the opportunity, and Deb for your coordination of this particular opportunity as well. On behalf of the Division of Student Development and Success, we want to welcome our students back, our staff back to the campus. We want to say that we certainly have had a decent and really strong transition back to campus from a student perspective over the last 2 weeks. We've coordinated, I think, pretty well with academic affairs and making sure the students and registration process went well for us and our students to return to campus. So we appreciate the support and the collaboration across faculty and student development and success over the last month to get that process underway. We certainly are going to make sure that we provide support for our students. As you guys may have seen this week, we launched a box lunch, a free box lunch for students every day, Monday through Thursday of the week in the Firebird Inn. And so from 12 to 2, students are available to avail themselves of that free box lunch via Perkins. And we've had some great success. I was down today and they had a great turnout, went through all those boxes in that 2-hour period. So we want to make sure our students continue to utilize that particular service from the university to them from 12 to 2, like I said, Monday through Thursday. And so we want to continue that throughout this semester. We want to make sure that also students know about, certainly if they have a need for counseling services, our ARC services, Accessibility Resource Center services, they can certainly reach out to us via our hotline and make sure that we are aware of what their needs may be. So we'll make sure we put the hotline information in that chat as well for everyone to be aware of. But happy to answer any questions specifically around students and student processes. We work with Deb Sullivan, of course, in going through the student exemption process and doing the same things and follow the same type of protocol that we've established for staff in that way as well. And we'll make sure notifications go out to those appropriately as we go through that review process also. But happy again to answer any questions that you may have or anybody in the chat may have around student development and success.
Thank you, Dr. Latham. And now we'll hear from Dr. Potter with updates from academic affairs.
Good afternoon, everyone. There are very few updates regarding COVID matters regarding academic affairs. One, I would say that all of the colleges and schools have access to PPE. And so any faculty member needing PPE within their classes should consult with their division or department chairs and or their deans. Our campus police has been very generous in providing PPE in all of the areas where it's been requested. We are aware that some students are uncomfortable with the protocols of mask not being fully worn in the classroom. And one of the things that I want to point out is that there is a mask mandate. And in that mask mandate, there are clear protocols that have been identified on the RISE website. I would encourage every student who is uncomfortable or any faculty member who is uncomfortable to review the protocol. There is a first step of kind of being courteous and asking people to just, hey, put your mask back on because I don't want to catch COVID. Although everyone in the classroom is vaccinated and or has an exemption, and those who are exempt are required to take tests weekly, there is a psychology around individuals wearing masks and their levels of comfortability. The mandate protocol clearly lays out if it is a student, if it is an instructor, if it is a visitor, what you should do. If you are not comfortable with reporting, with speaking to an instructor or asking someone from a courteous standpoint, I want to avail myself to make sure that we fully understand who is not complying with the regulations and the protocols on the campus. And so I would strongly encourage you to email cao@udc.edu. Very important, those emails come directly to the office inbox. Basically, I would just need the name of the class and the date and the time, and I will confer with the dean, and that dean will have a conversation with the instructor of that class. We want every student who has paid tuition to be very comfortable, and we want every faculty member who has come to campus to be very comfortable. And so if students are not wearing their mask as required in the classroom, faculty have the ability to ask the student to either wear a mask, provide them a mask if it is available, or ask that student to leave the classroom. The only other thing that I will provide in terms of bits of information is that we are consistently working to make sure that faculty are engaged through online resources, whether that is through our Learning Resources Division, which includes both our library services as well as the Center for the Advancement of Learning. Faculty, if there are any types of resources or assistance that you need, I would encourage you to reach out to both the library as well as the Center for the Advancement of Learning. Things seem to be going quite well within the classrooms from an instructional method. And I want to say thank you, faculty, for being attuned and abreast to the technologies that you're utilizing to deliver an excellent educational experience for the students at the university.
Thank you so much, Dr. Potter. We will now use the remainder of our time to go through the questions that have been posted in the chat and in the Q&A. And we understand and appreciate that there is some expressed concern about this new format, and we're just trying it, okay? Please be patient with us. One of the things we must reiterate in this environment is that things are rapidly changing. We pivoted to this format just because we want to make sure we optimize the time that we have available. We want to make sure we cover people's questions and answer everyone's question, that we register concerns. Again, we are recording these sessions. We will post it at the RISE website. We will also keep a log of all of the questions and concerns that are posted in the chat and in the Q&A, and we will monitor these to make sure we are clear about what questions remain lingering in the UDC community. Someone has asked whether the same-day test is a PCR test. The rapid test that we offer on campus is not a PCR test. It is a rapid antigen test. It would not be sufficient to allow you to return to campus, but it is sufficient for us to at least determine whether or not someone is positive. Another question that is here in the chat is, if someone has an exemption, are they required to take a weekly COVID test? Ms. Sullivan answered that. Yes, they are. That is monitored. Everyone, students and employees who have an approved exemption, they are required to submit a weekly negative test. The next question that we have is a statement: I was vaccinated and had COVID. The school should definitely do a weekly test on everybody that walks into the school. The demographics are based on people who reported to the school. You can be a walking positive in the school and wouldn't even know it, just spreading it without being aware that you're positive. And that's absolutely true. One of the things that we will put out there is that the cabinet is considering the logistics and feasibility of doing random surveillance testing, just so we can kind of encourage people to get tested during a specific defined segment of time and determine whether we can identify any positives from that. So stay tuned. We'll probably have more information about how that will be coordinated. We will probably offer incentives for people to get tested during a given week, and we will see if we identify anyone who does test positive. But people should be aware that, you know, everyone on our campus is vaccinated, and we have confidence in the vaccinations. And so this is why we would not be just testing everyone on a weekly basis, because we are requiring that people who are on site are vaccinated, and being vaccinated substantially reduces the likelihood that you would contract COVID. Now, the person who posted this statement is absolutely correct. There are instances of breakthrough cases, but they are rare. So because we had a vaccination requirement, we would not be mandatorily testing everyone, but we will probably do some random surveillance testing. I'm getting to more questions. There's a question for Vice President Franklin. Has the circulation and filtering been improved in all of the buildings? VP Franklin, do you want to reiterate this? I know you covered this in your response, but can you speak directly to the improvements that have been made in the HVAC systems?
Yeah, appreciate the question. So with respects to the HVAC system and the air filters, we have changed out all of the air filters in every one of our buildings. Those buildings that the university own and those buildings in which that we're actually leasing. And our plan is to continue to change out those filters on a monthly basis, just to ensure that we're giving the best air circulation as possible. So we have done that, and we will continue to do that again on a monthly basis.
Thank you. There's a question about, is the school planning on changing policy due to the Delta variant and further into the winter? I'll let Mr. Bako speak to that. Basically, we are looking at our policies and making adjustments accordingly, certainly given the environment that we're in right now. But Mr. Bako, would you like to speak to that?
Sure. Thanks for that question. It's a good one. Our policies and procedures for COVID, including addressing the Delta variant or any other variant that might come along, follow closely along the lines of the recommendations from the Centers for Disease Control and DC Health. And so within 24 hours of any district policy going into effect from the DC Department of Health, we will take that information and integrate it into our own policies. So I can't say now that we're going to change anything at this time due to the Delta variant, but if it becomes a public health concern, we'll respond as quickly as we need to.
Thank you for that. There are some kudos to be expressed to the cleaning staff. Someone's saying they're doing a great job. So Mr. Franklin, please make sure that they get those kudos. There's another question about someone is located in building 71. They're saying that they have neither warm nor hot water in the ladies' room to wash our hands. Can this be fixed? So I'm sure Vice President Franklin will ensure that the facilities team is alerted to that to make sure that that is remedied.
Yeah, they have been. The facilities team is now aware, and we have actually sent maintenance over to that location.
Mr. Franklin, while you are on the screen, there's a question about, are we planning to get well certification?
I would have to look into that one. I will follow up with that of our VP of Facilities, Mr. Dusan, and I'll get back to you very shortly in the chat on a response on that.
Okay, thank you. Dr. Potter, this is a question I believe for you. This individual says, I'm a junior and my major is elementary education. I'm taking practicum 1. I understand that course is normally in the field, but with numbers rising in DCPS, why would student teaching or student observation be required right now for us? I saw in the news that nearly 850 students and 120 staff members had to quarantine. Vaccinated or not, it is still risky at the moment.
And so I would say to the student, I highly doubt that there are those numbers in one school setting. That's probably cumulative across a number of DCPS schools. But the education program at the university is CAPE accredited. And let me just give you an example. When we went into COVID posture, emergency remote instruction in March of 2020, our nursing students were in the hospitals. They were working. When the COVID started to rise, we removed those students and our instructors were able to deliver their clinicals through a simulated virtual experience. I would encourage you to reach out to Dr. Anika Burton, Division Chair for Education, and have the conversation with Dr. Burton about the planning process with DCPS per MOU. It is highly unlikely that if a school where you are doing practicum 1 has an outbreak, we would require you to be in an environment where there is an outbreak. And so there are alternative plans in the planning process to address these matters. And I would encourage you to reach out to Dr. Anika Burton.
Thank you, Dr. Potter. VP Sullivan, this is a question for you. Someone is asking for clarification about the number of faculty that are non-compliant with the vaccine requirement.
I'm sorry, I had to unmute myself. Thank you for the question, Dr. Guillory. In my report today, I did not break out specific employee groups. I will be happy to do so in the next report. What I did share was that we had a total of 125 employees who were non-compliant across the board. We do have a number of faculty that have full remote or full online courses, but I will provide that in the next report.
Thank you. Dr. Potter, this is a question for you. What if I got the first shot, but I was told to wait before getting the second shot due to being immunocompromised, but I was dropped from some of my physical classes?
And so, to the student with this question, you are absolutely correct. Effective September 2nd, any student who was not fully vaccinated was administratively dropped. The memo that I sent out on August the 30th explained that process. While I recognize and empathize that you are immunocompromised, I think the best course for you at this particular point is to consult with the instructor and to find alternative ways of completing the course through a remote delivery mode. Many of the faculty have been very flexible. And so I am sure that if you were to reach out to the faculty member, they will make accommodations given the fact that you have yet to have your second shot.
Thank you, Dr. Potter. This is echoing a previous sentiment that we just reviewed. The focus on just getting people vaccinated is scary. The school does not make a mandatory test for everyone weekly or once a month. The results on people who tested positive at those that reported it to the school, not due to COVID tests, that goes on weekly by the school. And that is accurate. Let me reiterate that the mandatory vaccination requirement is the best practice and policy for protecting the institution. I should probably contextualize a little bit of where I'm coming from. I actually came to UDC from Morehouse School of Medicine, where I coordinated our return to campus efforts among COVID. And we were one of the first campuses to return to campus amid the COVID pandemic. We returned to campus in June of 2020. So we were back on campus over a year ago, and we went through a battery of requirements from mandatory testing, ultimately to mandatory vaccinations. Again, we were a medical institution, so we were dealing with clinical and healthcare workers who were dealing on the front lines with COVID patients, and then coming on our campus to teach in our classrooms. And even there, once we had mandatory vaccinations in place, we did not continue mandatory testing except for surveillance testing and for those who had a waiver from the vaccine requirement. So we hear you, we recognize that people would feel more comfortable with more testing, and we will look at a way to implement that. It probably won't be full scale mandatory testing, given the fact that we have a mandatory vaccination policy in place. But we will try to increase the surveillance testing that is done on campus so that we can capture, get a sense of how many positives are actually out there. Someone is asking specifically from updates for Building 46. VP Franklin, I think this is for you. Are there updates regarding Building 46?
Appreciate the question. So with regards to Building 46, we have recently replaced the windows, and we're looking to do upgrades to the roofs as it pertains to that particular building. But full transparency, that is one of the buildings that, again, requires a significant amount of work. And we are working with data facilities and actually determining whether it is actually worth the investment to put a new roof on there or looking at just a complete renovations. So we're in the process of, again, assessing that building. We completed the windows, but we need to do a larger assessment in terms of how much work is really needed and the cost of that, and whether it really requires a full renovations as opposed to piecemealing as we're doing currently.
Thank you, VP Franklin. I see where Vice President Latham referred someone to the student hotline number. Dr. Latham, do you want to clarify that?
Yes, I mentioned that in my comments earlier, Monique, so that's why I put in the chat so they can have access to that and use that anytime they need to reach out to STS to get any services they may need for their respective circumstance.
Did you include the number? I don't actually see the number.
Yes, it's 202 number should be in there with the email.
Okay.
I'll put it back in if it
Okay,
was
that'll
not.
be fine. There's a comment again here that says this can result in a lawsuit. Anyone can have COVID and not have symptoms, and people can choose whether or not to report their COVID results or not because the school doesn't do a mandatory COVID test for everyone weekly. I don't know if General Counsel Russell is on the line. We would actually have her speak to that since she deals with institutional liability. But Mr. Baker, would you like to speak to that since you are in the Office of Risk Management?
Sure. I can't really comment on the lawsuit portion of that. However, I do know and can say that all COVID test results are reported to the Department of Health. And so if you go to any local COVID test provider and you do test positive, it's not really your option not to have that reported to the Department of Health. It will be reported, and that will, in course, notify the university through that mechanism. And so we will find out, even if somebody chooses not to report it directly to the university, it's very likely that we'll find out that somebody has tested positive.
Thank you for that clarification. There is a question here about the student vaccination rate. They say the student vaccination rate seems really low. Is there a plan to get that number up? We want to make sure everyone saw the clarification that went out today. Yesterday, we reported that it was around 40–50%, but that was of all registered students, not the students who are actually occurring on campus. I think Dr. Potter, you might want to clarify that, but I think it's actually closer to 93%. Is that correct?
Yes, all students who are at least in one person course, meaning they have a hybrid course or they are fully face-to-face. The numbers that you saw on yesterday in the announcement read 54%. That was for the total population, inclusive of face-to-face and fully online or remote. When you disaggregate that and you look at the number of vaccination verifications based on the registrants for all of the courses that we offer in person, the number is 93%. So we're doing pretty good as an institution.
Thank you for that clarification. And in the newsletter that we're going to start circulating on a weekly basis, we do want to start publishing a dashboard about cases, any changes with vaccinations or things like that. Like, you know, for those employees who are non-compliant and are currently off-site, once they become compliant, they are able to return to UDC work sites. For students, however, you know, they may become compliant, but it would be too late for them to kind of pivot and go into in-person classes. So we will be providing updates along those lines. We have a comment here about a clarification that breakthrough cases are not rare. I have done and I'm still doing research on vaccinated people catching COVID. Thank you for that clarification. Maybe rare is not the accurate word to use, but we do recognize and acknowledge the protection that vaccinations do give us. We will soon start talking about booster requirements. That's going to certainly have to come into our conversations and consideration for protecting the campus community. Someone said people use fake vaccine cards all the time. The statement is scary. You cannot use faith to determine human beings' lives. Someone is asking, will the swimming pool be open this semester? VP Franklin, do you want to speak to that?
Yeah, I think I'm going to punt that one to VP
Latham.
Dr. Latham
Yeah.
should be able to address that one.
It will be. We published those a couple of weeks ago. I'll make sure we get them back out. In fact, I'll try to get the information quickly so we can put it in the chat. But that is open as well as the gym. We put that particular schedule out, like I said, through communications and marketing and athletics a couple weeks ago. But I'll try to get the information quickly and put it in the chat. But it is open this semester.
VP Sullivan?
Yeah, Dr. Gilley, I just wanted to go back to the comment on the fake vaccine cards. The one thing that I will say is that the staff and student health services they are reviewing the upload of the vaccination cards. And when there are any idiosyncrasies or any irregularities with the cards, they do ask that individual to bring the card in. And I'll share a really good example. An employee uploaded the first vaccination, and the second card came in and it looked very different. So what actually happened is the individual lost their first card, and it didn't match up with the second card didn't match with the upload of the second. So they ask the employee to come in and to verify. So there is a verification process. If we see any irregularities, or the student health services staff sees irregularities, we have had a couple of cases of forged vaccination cards, and those were addressed immediately. Thanks.
Thank you so much. We have a question here for Vice President Franklin. In light of Howard University's ransomware attack, are we vulnerable? My UDC has been down today.
Yes, appreciate the question. It's a great question. And I did have some conversations, extensive conversations with our new VP of Information Technology, Mr. Morgan. And what he has shared with me is that at the end of the day, all of us is vulnerable. But with respects to UDC, he has put several things in place and continues to work towards that. His background is really and truly specialized in cybersecurity. He's encountered this at his last university where there were cyber attacks. He was able to mitigate that with very little risk to the university. And he's bringing that very same skill sets here to UDC in terms of making our security system as secure as possible. So to answer the question directly, there are some risks out there, but we're working. We understand what those are. And that is one of the reasons in which we actually recruited Mr. Morgan based on his expertise in cybersecurity.
Thank you for that. Someone is commenting that the virtual sessions are helpful. Thanks for making them bi-weekly series. Thank you for that comment. And again, we aren't just going to rely on this. I mean, you can expect the RISE website to be updated on a regular basis, and we'll be reaching out to everyone directly with our weekly newsletter updates. So please review those when you get them. And if there is an urgency to a question or concern you might have, you can email that to covidconfidential@udc.edu, and you will get a response within 24 hours. There's a comment here about vaccines don't just end the pandemic. Booster shots wouldn't be talked about, and using faith to determine the entire body that walks into UDC is not okay. A mandatory test should be done weekly. And I have addressed that. We will be considering the feasibility of some surveillance testing. So stay tuned for that. I'm not going to give a faculty member, but we'll provide a breakdown. Oh, okay, that's from Deb Sullivan. She will provide some information specifically about faculty who are non-compliant. Thank you to all of you. Thanks to all of you for keeping us safe. This is a confusing time, so I know you all are doing your best. We appreciate it. And we appreciate, again, that comment. And we will reiterate, again, part of the reason why we are trying to provide these resources and open up these lines of communication is that, this is a really challenging and unpredictable environment. And we will ask for your patience. We are learning to live with COVID. I had this experience in my previous appointment, and it was important that we kept the lines of communication open. We repeated our messaging and made sure people were aware as things changed, because they will. As Mr. Bako stated, we are in alignment with the district's policies and procedures. And as those change, we will pivot to accommodate them. But one of the main things we want to reiterate is that we ask for your patience, your cooperation, and for you to stay in communication and contact with us as we help, to manage this situation and protect the community. If a student athlete tests positive and contacts COVID confidential protocol, I would want the SA to tell the head coach, is that a problem? Okay, and this is from the athletic director, Pat Thomas. The SA, Dr. Potter, can you speak to that?
Yes, Pat, I think to your question, if a student athlete is tested positive for COVID, I think that it would be really important and okay for the student athlete to share with the coach because of the close proximity, because of the practice sessions and the like. But I think that there needs to be some conversation with student athletes and how they report because it's really, really, really important. Dr. Latham, do you have any other insights on how you would like to manage that since athletics reports to you?
While we're waiting for Dr. Latham, let me just also reiterate that part of the reason why we're creating this kind of process and chain process of information is that people should remember that COVID test results are protected health information. And actually, everyone isn't really privy to having that, even though it's important for people to be in the know. If you tell certain people who are actually not authorized to have that information, it's almost a burden of responsibility for that person. For students specifically, we have created a process where they report it to COVID Confidential, and student SDS is immediately notified. And we would certainly ask SDS to work with athletics to make sure the necessary protocols are followed to protect teams and other student athletes. We have a similar requirement for students who are residing in university sanctioned housing. We have a different kind of process for them to make sure we have someone to look in after those students who are in our housing. So Dr. Latham, do you want to speak to that?
Yeah, I'm just reiterate the question. Somebody dipped into my office and knocked on the door. So tell me what the question was directly, Monique, if you don't mind.
It was about student athletes and the process of notification if a student athlete tests positive.
Okay, definitely. It's the same process for the student athletes in that regard as we've outlined for students, as you mentioned, through the university and the overall COVID task force. Fortunately, we haven't had that occur. We have a very strict protocol around the acclimation process that they started back in August and continue through that process this semester. And the coaches are certainly the rest of the staff are very cognizant of that process and have a very strict guideline around what can and cannot be allowed with student athletes as they go through the season, right, and practice and of course and compete. So we will make sure that that's strictly adhered to from Athletic Director Thomas's perspective. That's her commitment to the university and to the safety of the students overall. But fortunately, right now, that's been something that we've been able to really regulate pretty strongly and have success with thus far.
Thank you. There's a question here. I think this is more directed to Vice President Sullivan. What sanctions are applied to faculty who are not compliant with the vaccine requirement?
Thank you for the question, Dr. Guillory. First and foremost, as most of you know, the university implemented the vaccination policy and it was distributed to the university community in May. As such, that policy states that vaccinations were mandatory, and if an employee was not compliant, we would work through the disciplinary process up to termination. We have 3 collective bargaining agreements that we work with all of our unions, and so of course we would be following the process there as well.
Thank you, Ms. Sullivan. Someone else commented, this is very helpful. Even if students are not vaccinated, they are not on campus. I'm happy we're having this forum to discuss our concerns. This is a great idea for everyone. We're being transparent, and that's important. I'm so proud of UDC. Thank you. That's a spirit that will really help get us through this. And again, we are really doing our very best. You have a wonderful team here. We communicate about these things on a regular basis. And once again, I just can only reiterate, we ask for your patience, your participation, your cooperation as we all work through this process. Is there an update on when MyUDC will be back online? Chief Franklin, can you provide an update on that?
Yes, MyUDC was restored, give or take, maybe around 12 o'clock this afternoon. So it is up and running at this point.
Thank you. Someone pointed out that when MyUDC is offline, we can access Blackboard by going to, and they provide the web address in the chat, This should be announced prior to these breakdowns, but my UDC seems to be working now. So that's in alignment with what Chief Franklin just mentioned. Yes, and so we'll go to the questions. There are a few questions in the Q&A. And again, like I said, we will keep a record of these and we will try to address these in this recording will be posted at the RISE website, but we will certainly keep monitoring all the questions that come up in chat. So let's see. There's a question in the Q&A about why we aren't being tested weekly. And again, I'll just reiterate, that's because we have a mandatory vaccination policy in place. There's another question about people not wearing their masks properly. And I think Dr. Potter addressed this, that, you know, we are trying to adhere to a process of reminding people to wear their masks, to put their masks on properly. If people don't feel comfortable approaching someone about fixing their mask or about wearing a mask, we have heard this concern from some students. Again, you can report this to COVID Confidential, and we would ask that if you're reporting a general observation, give us some information about where this happened. I know Dr. Potter, you know, gave the CAO email address with, if it's a class or a faculty member, if you send that to him, he can address that directly with the deans and whatnot.
And the associated banner attributes needed to deposit the funds.
Oh, okay. You can deposit funds. I can tell you where you can do that. So there are multiple channels that you can use to report your concerns, okay? But we do have a mandatory mask mandate. I'm trying to see the rest of the questions.
Dr. Guillory, there was a part of that question was about visitors and folks not wearing masks. We are implementing the ambassador program starting around the 16th. And so there we will be posting ambassadors at a number of the entrances to help, one, distribute any PPE that may be needed, but also to remind individuals if they're not wearing their mask properly, just to be helpful and to provide instructions or directions as needed.
Great, thank you. There's a question here about there's absolutely no way to socially distance with large classes in small rooms. For rooms and classes, this is an issue. Let's see, I'm having a difficult time to see the whole question. Alex, do you want to speak to that and how we have to align basically with the district requirements, that there is no social distancing requirement in the district? Therefore, we really cannot require social distancing on campus?
Sure. So again, I can't see the exact question either, but I will say that during the height of the pandemic, there were very specific restrictions placed on certain types of events, and whether it's fitness centers and restaurants. And there was a cap on any public event, I think, for a while there. But the district has moved into phase 3 of the pandemic response, and the mayor removed those physical congregation or limitations. And so we're following that right now. And because of that, there are absolutely no physical distancing requirements in classrooms. If things change, if there is a recommendation or any sort of requirement from the mayor to put physical distancing back in any part of campus, we'll do so immediately.
I'd add, I think that question comes from Cheyenne Barber. And Ms. Barber, we've been extremely conscientious of capping courses, even though there are no social distancing requirements based on the district government and district health regulations. We've been pretty insistent that we have caps on classes. And so we're not running classes at 30 and 35 because quite frankly, many of our classrooms don't accommodate those size classes. And so if you are in a class and you believe that the number of students in that course is too large, I'd like for you to send the name of the course, the time, and the section so that I can review what is in that course in terms of numbers. And figure out what your real concern is, because we've been very intentional about capping courses.
Thank you for those answers. There's another question that professors feel obliged to take off their masks so they can be heard. Can the university provide classrooms with mics so that there's no excuse to remove a mask?
And so, Ms. Barber, again, one of the things that I will say to you is that we are dealing with a 1950s, 1960s infrastructure. And so there are no mic outlets in most of those classrooms. We are currently reviewing new products on the market. And if we find market compatible microphones, we will make those purchases, and then we will begin to test and develop and issue microphones in spaces. But at this particular point, there is no way to issue microphones or PA systems in a classroom because we're just not outfitted that way with our 1950s, 1960s infrastructure.
There should be self-serve cleaning areas with supplies similar to what's provided at Planet Fitness. Before, after you use a computer, desk, or et cetera, you clean it. This should be in every public area and outside of classrooms. Chief Franklin, would you like to speak to that?
You hear me? Oh, yes. Just having a little. So with respects to PPEs, if anyone is requiring PPEs, what we recently did, we added to the LiveSafe. So if you go to your LiveSafe, we've now added as part of that application, an area where you can actually request PPEs. And once that we do receive that information, it's coming directly to our public safety and emergency management team. We will even schedule to either deliver them, or you can actually pick them up from the Student Center Help Desk. So we just recently added that application and made that available to student, staff, and faculty as well.
Thank you so much, Chief Franklin. If a student no longer feels safe in a face-to-face class, can we please register for an online class? And if so, would there be penalties?
So I would say to the student who does not feel safe, registration is closed. Registration closed on September the 2nd at the end of the expanded drop-add period. I would encourage you to meet with your faculty member and to see if that faculty member will make an accommodation for you. If there is no accommodation, then you should meet with your academic advisor or your professional advisor to see if there is the possibility for you to transfer out of a face-to-face into a remote section that is available. The only caveat there is that if it is a different section and there are different assignments, you will be responsible and accountable for that transferal. And so you need to be very careful in making these types of transitions at this point in the semester. But I would strongly encourage you to work with your faculty member to see if that faculty member would be willing to offer an accommodation, as many of them are for their students.
Thank you, Dr. Potter. Can these town hall meetings be posted and advertised on UDC socials? In addition, how do you expect the students and faculty to participate if you hold the meetings during popular class times and during work hours? If this is happening bi-weekly, then there needs to be other times. This meeting time needs to change to accommodate the UDC community. So I'll just speak to that. This is our first town hall that we are ramping back up following the series of town halls that we offered in preparation of returning to campus. We are planning to alternate them every other Thursday. Right now, they are scheduled to occur at the same time from 2 to 3. And we recognize that there probably is not any time where everyone would be accommodated. But to address that, these are recorded. They will be posted at the RISE website. And if there are any questions or concerns that still arise out of these meetings that are not resolved, There is the channel of the COVID confidential email address where we will rapidly respond to those. Again, we will certainly consider other options, but we do hope to have multiple channels of communication and engagement with the UDC community. I saw that students were not wearing and or fully wearing a mask entering and walking around building 38 level A. Again, that would be something to help us, monitor a little bit more specificity. This is a mask mandate, a mandatory mask campus. So we certainly would encourage you to politely remind people to put their mask on properly. If anyone is resistant, we don't want anyone to put themselves in harm's way trying to enforce the mask mandate. You can certainly find someone who's responsible for that area, a manager or an instructor or a chair, to assist with reminding people about the mask mandate. But if you report something like this to the COVID confidential email address, we would appreciate all the details you can provide so we can follow up and make sure people are aware. And someone said they joined late, but why aren't we testing weekly? We are considering random surveillance testing, but we are not testing weekly because we have a mandatory vaccination requirement. And once we're clear about boosters, we will probably be requiring those as well. So stay tuned for that. And again, the final question is about breakthrough cases. It's concerning that people may be on campus asymptomatic and spreading COVID. And again, that is the purpose of our surveillance testing. We will provide more details along those lines at either in our weekly newsletter or during the next town hall. So with that, that's all the questions that I see here. We will have a record of these questions, both from the chat and the Q&A. Are there any final words, comments, updates that any of the panelists would like to provide? Okay.
One last time.
Go ahead, Alex.
One last time, COVID confidential at udc.edu. Send your comments there. Thank you.
Just one quick thing. Just thank everyone for joining today. I will make note that the Office of Human Resources will be sending out additional guidance. A number of our employees received a message from the District of Columbia, DCHR, about uploading vaccination information to PeopleSoft. We just ask everyone to stand down. We will be providing you with guidance. The university is much further ahead than DC because we mandated vaccinations much earlier. So we don't want you to do double work. So we're just asking everyone to pause, and you'll receive instructions at the beginning of the next week. Thanks. Have a great week and a great weekend to everyone. And thanks for all you do to support our students and the Firebird Nation in general.
Okay, and thank you all again. I want to echo Vice President Sullivan's appreciation. And our next town hall will be on September 23rd. Help spread the word. You will receive invitations and reminders about the town halls, but right now they are scheduled for every other Thursday from 2 to 3. Please encourage people to attend. And if they have other urgent questions or concerns, to post them at COVID Confidential. Thank you for your attention and participation today.